Why is denosumab so expensive for osteoporosis? Have you ever wondered why some medications come with a hefty price tag? Denosumab, known by the brand name Prolia, is one such medication used to treat osteoporosis. Its cost can be surprising, especially for those managing this condition. So, what makes denosumab so expensive? First, denosumab is classified as a biologic drug. This means it is created from living cells through complex manufacturing processes. These processes are significantly more expensive than those used for traditional small molecule drugs. Unlike standard medications, biologics like denosumab cannot be exactly replicated. This unique nature limits competition in the market, allowing prices to remain as high. Currently, there are no biosimilars available for denosumab. Biosimilars are biologic medications that are similar to already approved drugs but usually come at a lower cost. The absence of these alternatives means that only the brand name version of denosumab is sold, which further contributes to its high price. Denosumab is administered as a subcutaneous injection every 6 months, which requires a visit to a healthcare professional. This adds to the overall cost, as patients often incur medical visit fees in addition to the medication price. Insurance coverage can also play a role in how much patients pay out of pocket. Sometimes, prior authorization is needed, which can delay access and increase costs if approvals are denied. The high cost of denosumab is also tied to its effectiveness. It is often the first choice treatment for patients at very high risk of fractures, such as postmenopausal women with severe bone loss or those who have experienced multiple fractures. While the expense can be a barrier for many, its ability to significantly reduce bone loss and fracture risk justifies its use for those who need it most. Manufacturers sometimes provide savings programs or patient assistance to help eligible individuals manage costs. However, even with these options, denosumab remains more expensive than many oral osteoporosis medications, like bisphosphonates. In summary, the high price of denosumab for osteoporosis is due to its complex biologic nature, the lack of generic or biosimilar alternatives, the requirements for administration, and its role as a specialized treatment for severe cases. It is essential for patients to discuss cost-saving options and insurance coverage with their healthcare providers to effectively manage expenses.